Hello, everybody. I am Josh Corman with the International Spa Association, and I am really excited today to be able to talk with Dr. Brian Fallon, Dr. Brian Fallon, not Brian Fallon, that wouldn't be good, with the Columbia University Medical Center. Dr. Fallon, I'll let you introduce yourself. You're, in the midst of some research that's particularly interesting about the anxiety of the moment. We know that we're feeling a lot of stress at the moment. And so why don't you tell us a little bit about yourself and about that research?
Sure. Well, I've been studying anxiety for about 30 years. And my particular interest when I started was on obsessional forms of anxiety. So people who have obsessive compulsive disorder and people who have hypochondria. So when you think about those two disorders and you think about the current pandemic of COVID-19 and the fears that people have, you can see how the things that I've been studying for so many years relates to what people are experiencing in their actual lives throughout the country and the world. So one of the, obviously we were all profoundly distressed and anxious as COVID-19 hit us. We were watching it occur in China and then very saddened by what we were seeing in northern Italy and then throughout Italy, and then it hit the United States. And honestly, we were all quite scared, and the United States really was not prepared and didn't really know what to do. So whenever you have a situation where you have uncertainty, which is what faced us at the very beginning of this pandemic, you end up with a situation of increased anxiety and stress. So it occurred to me as I was trying to figure out what we might be able to do as psychiatrists from the Columbia Medical Center and as a mental health team, what we might be able to do to help people remotely. And we had been, another area I study is Lyme disease and the effect of Lyme disease on the brain and on chronic symptoms. And we actually have been preparing a study, an online study, to look at meditation and Kundalini yoga as a treatment for the chronic symptoms that many of these patients experience after antibiotic therapy, to see whether it might help. So then I thought, well, maybe we can convert that study or to create a new study focused on COVID-19 anxiety. So people who have increasing stress, bodily tension, trouble breathing properly in relationship to the COVID-19 situation, so that they can actually enhance their sense of personal resilience, enhance their coping strategies, and maybe get along better with many of the terrible situations that they have to deal with. I mean, people are dealing with job loss. They're dealing with, how am I going to pay for food? How am I going to be able to pay for schooling? How they're dealing with the loss of loved ones. They're dealing with tremendous sickness in some of their loved ones. They're dealing with the fear of having to go back into the world now that COVID-19 the epidemic is declining somewhat. People are talking about going back into the world, and that's for some people not a big deal because they're not worried about it, they don't care about it, they don't feel that they're vulnerable, whereas others feel a very high sense of vulnerability and are very concerned. If you're a healthcare provider or a spa person working in a spa as a therapist, you are going to be concerned because you have direct, immediate contact with people. So anything that any kind of job that entails that degree of close physical contact is one that would increase risk. So I think that healthcare workers, people who work as porters in buildings, people who work in elevators, people who work where there's close contact are aware that they're at increased risk. And so their sense of vigilance and anxiety will increase as they start to return to some of those jobs.
Yeah, I think that rings true inside the spa industry. It comes from both sides. One half of it is, as people, as spa directors and owners plan to bring their staffs back to work, there's obviously concern from the staff's perspective, like you said, about working in close contact, and that can raise anxiety levels. Even people who are excited to get back to work and generally feel comfortable, the anxiety may still be there, even if it's not acute or showing up to them in really clear, demonstrable ways. And, on the other side of it, from the guest perspective, we are, as you said, living in a time of high anxiety, of high stress that's sort of, it feels often as though it's simmering sort of constantly, even if, again, it's not noticed. And, they're hopeful, I think, spa professionals about the role that spas might play, the ability of something like meditation or yoga, and just general mental well-being and general mental health, as being something that can exist as a response to the anxiety that COVID-19 has brought along. Without trying to get into every detail of what an immune system's response might be to stress, generally speaking, what do we already know about the body's response to stress, and how things like meditation and yoga, and practicing good mental health can sort of have on those.
Sure. Well, everybody's heard of the fight or flight response. So that's when you sense a danger. That's when you think, oh my God, something awful is about to happen and maybe my life is at risk. So you either fight or you flee. And the body's response to that is your amygdala starts to become active. It sends signals from the brain down into the adrenal glands. The adrenal glands start to produce epinephrine. The epinephrine then floats out into your bloodstream, causes increased breathing, causes increased heart rate, causes increased oxygenation, causes your muscles to be really prepared to fight or to flee. So that's the immediate response. And the subsequent response, the more chronic response, is elevated cortisol levels. And when cortisol levels are elevated, that can decrease your immune response. So we all know that, for example, medical students, when they're working really, really hard and studying really, really hard and very stressed, that they're more likely to start getting infections. So anybody who's under situations of stress will be more likely to suffer from infections. We know that meditation helps to reduce anxiety. We know that physical exercise helps to reduce anxiety. We know that yoga exercises and stretching helps to reduce anxiety. We know that massage helps to reduce muscle tension. There's a well-known technique called progressive muscle relaxation therapy, where you start to just relax the different muscles in your body, start to breathe more deeply, and that helps to calm the body. So we devised a study in which we're giving everybody well-known techniques for reducing anxiety using cognitive behavioral strategies. This was actually a program, a self-help program that was developed online by our Australian colleagues. So they gave us their psychoeducation materials, and they're based on cognitive behavioral strategies that we know help. Because if you have catastrophic thinking about what's going to happen, if you try to predict the future, what's going to happen 2 weeks from now, as opposed to staying mindful and in the present, then you know that you're going to have increased anxiety and fear. So that's one of the things we're doing in our study for people with COVID-related anxiety that's available on proofpilot.com. 2/3 of the people will then go on and get a mind-body therapy. So one group is going to get progressive muscle relaxation with meditation. The other group will get Kundalini yoga. Kundalini yoga, if you're not that familiar with it, is a combination of movement, breathing, as well as meditation. So our goal is really to help people in reducing their anxiety. If we had known about your being available, we might have put in a massage component, because I'm sure that would be enormously helpful for people.
I'm sure that you
hydrotherapy also. I mean, everybody, we know that being in warm environments and hot baths can be enormously helpful. So there's so many things that can be helpful. So we just chose.
I'm sure that there would be many people in the spa industry who'd be eager to see. I think, that is something that the perspective we've heard a lot. This is an industry focused on wellness and focused on, really that mind-body aspect that you mentioned. It's attacking it kind of from every angle. And I think their hope would be that there can be some sort of, benefit out of a dark situation where, maybe people's awareness of their overall wellness it's more front of mind. I was, like many of us, I was on a webinar earlier and listening to people from the Global Wellness Institute talk about exactly that, these responses that are undertaken in the moment with the intention of alleviating some of this anxiety and addressing some of those concerns that you mentioned. Hopefully those things become practices that are consistent, that go forward, because, we all know that when spas reopen, when businesses reopen, when restrictions are lifted, that's not the end of the anxiety from COVID-19. That is something we've seen a lot about, people being warned, be on the lookout for how mental health is affected 3 months, 6 months, a year down the road.
Another thing that's happening is that the current trauma of COVID-19 and what's happening in our society and to people you might know is reawakening early traumas. So people who have had traumas in their childhood might suddenly find that they're feeling like they have a need to rescue everybody. They have
Right.
That catastrophic feeling that they had when they were a child, that the world is falling apart. And so they start to replay it in their daily life currently, that the world actually is falling apart, that there is no hope, and that you can't trust anybody's information, and that there will never be any good treatments, and there will never be a vaccine that works, and it's going to be a total disaster. So this pandemic is affecting people's mental health in many different ways. Now, if you happen to have obsessive compulsive disorder where you fear contamination and you spent a lot of your time actually washing your hands, being careful about germs, not touching subway poles, all the things that might cause you to become sick, you're actually well prepared for this current pandemic. So in many ways, you feel less isolated, you feel less alone, you feel like, oh, this is great, everybody's doing what I've been doing for a long period of time. On the other hand, once you have to go back out into the world and face the things that you've been avoiding, just as everybody who doesn't have OCD is going to have to do, it can become more problematic. So another thing we know is that touch is super important. And a lot of people right now aren't being touched. A lot of people are isolated. They can't see their friends. They can't get hugged. So if you're not being touched, that's going to have an impact on your mental health. We know that touch is enormously important. What about wearing masks? If we're wearing masks and all you can see is the eyes, that certainly is a part of emotional communication, the eyes. But what about the smile? What about the face? So we're missing very important emotional cues, and we don't know exactly how that's going to affect the mental health of the public.
So then as people, come back into the workplaces who, like you said, may have, been for a couple of months outside of what their normal day-to-day life looked like, as recently as a few months ago, are there markers to be on the lookout for, or steps that can be taken by, team leaders in spas, for example? Really, I think it would apply to just about any business, but like you said, touch and the close component of contact with people is sort of an added layer there that they can be on the lookout for to help their staffs with their mental health, and being on the lookout for those, cues that,
Sure.
that, hey, your anxiety might be building up.
Yeah. Well, just like any good parent, the best thing you can do is model good behavior. So wear a mask, wear gloves, of course, and communicate to the client that you really care about their health from a personal perspective as well as an infection perspective. So as long as that's being presented by the staff, I'm sure that the clients will feel enormously reassured. Now, sometimes you'll find clients who ask questions repeatedly. And if they do so, whenever someone uses the question like, what if? Or how can I be sure that you've done enough cleaning? Or what if you missed this? Or what if I didn't tell you exactly what's going on with me? Then you know that that person has obsessional anxiety. And obsessional anxiety starts with those, how can I be sure? Because they can't deal with any uncertainty. Obsessional anxiety is something that can be helped by mental health practitioners. It can be helped because they can help address the dysfunctional or irrational thinking patterns that catastrophize the situations. It can help reduce their need for 100% certainty. And also there are medications that can be helpful as well. Serotonin reuptake inhibitors can be very helpful at reducing obsessional anxiety. Exercise can be helpful, and the spa treatments themselves can be enormously helpful at reducing stress and anxiety. But those are sort of clues when people are Or if someone suddenly starts bursting into tears, obviously you know that person is in great distress. If someone has any suicidal thoughts, then obviously they should see a mental health provider, call a suicide hotline. Um, I think when people start talking in a hopeless fashion, then you have to be concerned.
Well, and we would hope, I think, that, obviously people who now have to be in close contact with each other, they come back to work. We've seen an enormous amount of support for the teams that work in spas from the people who run them, who may still, sort of be on staff there. And as they're preparing to come back, I know that's something that we've heard a lot, that they are concerned about, that, like we said, reopening is not the moment it ends, that it's going to continue to be something that needs to be monitored and have people pay attention to it, obviously themselves, but be on the lookout for those close to them for, some of those signs that you mentioned. Because as they come back to the workplace, they may not realize how big a stressor it might be to return to that, to that new environment, which will probably feel different to them than it did before they left.
Yeah, and I don't know exactly what kind of guidance the organization is giving to the spa leaders in terms of how to prepare your office, whether you're going to be doing temperature checks for people as they come in. I don't know exactly what the thoughts are in regard to that.
Yeah, I think that by and large, we're urging people to follow their state and local guidelines, the CDC and what they're putting out there. And obviously, from the corporate level, a lot of spas where they, sort of under one umbrella have talked about, the steps that need to be taken on the front end. And they're enormous. The spa industry is, I think, something that I'm learning too, as somebody who's sort of come into this relatively recently, is just how proud they are as an industry of the health and sanitation guidelines they already followed. They're doubling down and really emphasizing what's being stressed to do. But I think for a lot of people who, aren't in the day-to-day looking at COVID, looking at planning for reopening from that perspective, they're just somebody who wants to get back to work. They may not have that research fresh in mind. They may not have, the proper protocol. So trying to provide that stuff has been, really the emphasis of ISPA, and I think around the industry as well. Putting people in a position to feel safe and comfortable when they come back, because if that's not there, if there's this anxiety lingering as people walk back into their workplaces, you're sort of starting 6 steps behind, because that's a tough position to put people in.
Spa therapists are the healers, so they have to feel totally comfortable and happy in their own space and their own bodies, so they can communicate that to their clients. One of the interesting things that we've done over the last few years, I actually started out as I started out as a person interested in psychiatry and religion. I then got involved in biological psychiatry because I saw it as being enormously effective in many ways for lots of people. Over the last, let's say, 10 years, I've gotten more interested in how do you help people with chronic symptoms, chronic pain, chronic fatigue, chronic cognitive problems, chronic mood dysregulation. And certainly psychology has a lot to offer. Certainly these mind-body therapies have a lot to offer. We just finished a study actually looking at group Kundalini therapy, yoga therapy for people with chronic symptoms associated with Lyme disease. It's a small study, and it was done by a wonderful psychiatrist here in Connecticut, Dr. Charles Alexander, out of the kindness of his heart, because he is a Kundalini yoga teacher, and he just wanted to be able to show that it works and offer it to people. So we decided to do a study with him. He didn't get paid anything for it. He was so good-hearted and generous. And lo and behold, it does appear to be the case that the Kundalini yoga does help to reduce, compared to the weightless control group, the intensity of the physical symptoms. It helps to reduce fatigue. It even had some effect on reducing cognitive complaints. So it's totally fascinating that something as simple as light exercise, light yoga, breathing, the Kundalini breathing is a certain type of breathing, and then a gentle meditation can actually, in just 8 weeks, lead to significant improvement. People were very happy at the end of that treatment. So we're hoping that in the study that we're doing with the COVID-19 anxiety, the same thing will take place.
Well, I'm sure that people in the spa industry will be interested to see those results, because I think that a lot of them would echo what you're saying. They would feel confident in saying, that they're that they would see effects from, from mind body therapies, from yoga, from meditation, that a lot of what they're trying to put into people's lives, mindfulness about their own wellness and an attention to their own wellness and to what they're feeling, so that they can, more adequately advocate for themselves, so that they can share and communicate with others what they're going through. And hopefully that is borne out by your research, because as you said, and I think we all feel, right now is a moment of tremendous anxiety and stress, and there's so many people who are maybe experiencing that in a way they haven't before. So the need to be mindful of those things is probably greater than ever. And as they return to work, that's going to be something that they need to be watching for.
Yeah, and there's a lot of great information on the internet and in the media about how to improve coping skills. And coping skills obviously are enhanced by staying connected to your loved ones, reaching out to people who are in need, trying to do good in the world, because when you do good to others, you start to feel better about yourself as well as helping the other individual. So there are all these strategies: keeping a regular routine, um, seeing your mental health professional if you are in therapy with someone, eating well, exercising, taking care of your body. If it's too stressed out, do things to reduce that stress. So all these are very helpful, and they work.
And I think you'll be getting a lot of people nodding along as they watch this, if they're inside the
Yeah.
spa industry. I think they feel similar, and like I said, hopefully the research bears that out, because I think anecdotally we see people throughout this industry is all the way in behind the benefits of of some of the things that you've talked about today. Thank you so much for taking the time, Dr. Fallon, to share some insights with us, and to talk a little bit about your research. And as people prepare to reopen and get back to work, we definitely want them to be as mindful as they can be about their mental well-being and the mental well-being of the people that they work with, and be a friend, be an advocate for yourself and for others as you go back into a strange new time in your work life.
Thank you, Josh. Pleasure to meet you. Best wishes
Absolutely.
to everyone out there. Yeah.
Thank you. And if you want more resources, or to see what ISPA has been up to as far as providing some resources for spas as they plan to reopen, including our reopening toolkit that's got a lot of good stuff in there, including another interview that we did with Dr. Brent Bauer and Dr. Nadir Bouyan at the Mayo Clinic, talking about spa reopening. So trying to put together some more of these these resources for you. Thanks so much for watching, and you can get that stuff at experienceispa.com. We will talk to you later. Thanks again, Doctor.
Bye-bye.
Bye-bye.